Thank you very much. And now approval of the minutes. I move to approve the January 27, 2021 meeting minutes. Do I have a second? Commissioner Casada seconds. Thank you. All those in favor say yes. Yes. And Julianne, please call the roll.
Okay, Commissioner Barbola,
Yes.
Councillor Davis,
Yes.
Commissioner Benson,
Yes.
Councillor Pena,
Yes.
Commissioner Casala,
Yes.
Councillor Sena,
Yes.
Madam Chair Viscotti,
Yes.
and Mr. Isaac Padilla. And I don't see him on, so called.
Okay, thank you. So that passes unanimously. Next is public comment. Julianne, do we have people signed up for public comment?
Yes, ma'am, we do. We have Casey Quirk, who should now be on the live side.
Okay, so should I go ahead and read the instructions?
Yes, please.
Okay. You will have 90 seconds to share your comments. You will then be notified when your time is up. You will then be muted and moved to the waiting room. Should any of the board members have follow-up questions to your comments, you will have an opportunity to answer. So go ahead, Ms. Quirk.
Thank you so much, Madam Chair. I don't know if you know this, but in the process of being invited, you actually go away from the meeting for a few minutes or a few seconds. And so I didn't hear most of what you said, but I understand I have 90 seconds. And I want to thank you, Madam Chair, and all of you esteemed county commissioners, county workers, city council, Attorney Martinez, and the folks from APS. Thanks for having us. You all did receive a written statement from my colleague, Peter Kubra. We both represent the Coalition for a Safer ABQ. And we have been extremely excited to be participating together with the county and the city in developing a process for moving forward with developing a joint gap and needs analysis related to behavioral health services for our community, as well as a follow-up strategic plan. I am here tonight simply to say thank you to both City Chief Administrative Officer Sarita Nair and our County Manager Julie Morgus-Baca for being willing to come together, recognizing that we in fact are stronger together than separately. There has, in our understanding is that there's an agreement that we are moving forward with a gaps analysis, and that the county is also moving forward with a strategic plan in which they will be inviting the city to participate in. Just for the purpose of conversation, when we think about gaps analysis, that may seem like we all understand what that is, but I just want to say, you know, really it's about looking at where are we and where do we want to go? And then the strategic plan becomes about how do we get there? And as I've been thinking about coming to you all tonight, the one thing I really want to impress upon you is the best strategic plans and the best gap and needs analysis that I've ever participated in, and I've participated in my leadership roles in several nonprofits here in New Mexico, are those that include the broadest number of individuals that we can involve. So it goes beyond just the officials, it goes beyond just the leadership, but it must include everybody, as many as we can get involved, employees of the various behavioral health departments, as well as those people that are impacted by the services that those departments provide.
You've passed the 90 seconds, so.
As is usual, I appreciate it, Chair.
Okay, were you finished?
Well, just to underscore that and the one other piece that we have asked is that because the University of New Mexico is so heavily involved with our behavioral health activity, that We also involve them in the planning, gap and needs analysis, and the strategic planning moving forward. Thank you
Okay.
for allowing me to go beyond my 90 seconds.
Thank you. Okay, so moving on to new business. And by the way, I think we all did receive the email from Peter Kubra. So I believe we've all read that. And if you haven't, please do. So thank you. So moving on to new business, a presentation by Counselor Pena on the Project Child Safe event.
Thank you, Madam Chair. This it's not really a presentation. It's kind of really just an announcement. And I love the baby. I don't know whose baby it is, but on behalf of Councilor Bassan, unfortunately she couldn't be here. But you know, she actually invited me and APS to participate with the national. I'm looking for the name here. The NSSF. To hold a Project Safe event promoting gun safety and suicide prevention. As you all know, and I think this will meld into my other announcement, but as you all know, as part of ABCGC, we were approached by APS asking that we kind of form a group to address youth suicide prevention efforts. And we've been meeting, and I think this is only our second or third meeting that we've had. We're actually in the process of making sure that we bring on additional partners, collaborators, stakeholders. Councilor Sena is going to now be participating, and other members who have said that they're interested. The meetings are just wonderful, and we have a lot of students from various schools throughout the district who are participating, that they came together because they, I think some students from, and correct me if I'm wrong, Miss Muir, but some students from El Dorado, where there was a suicide, and the students got together to try to make a difference. I think they presented to us at a previous meeting. And so through that effort, and I'm not going to go too far into that, but just through that effort, Councilor Bassan was approached by the NSSF and with this project, and I jumped on partnering with her. We're going to have an event this Saturday, March 27th from 10 a.m. to 12. And it's going to be at two different events. One of them is going to be where Councilor Bassan is going to be at, and that's at Vista del Norte Park at 1005 Osuna Road Northeast. And the other one is going to be closer in my district, which is Atrisco and Central at the Cons Home Plus at 4208 Central Avenue. And we'll be distributing, partnering with APD, APS Police, APS, and whoever else wants to join us, passing out gun locks and information resources for suicide prevention. So I think I covered everything. As you can see, if you've noticed on my Facebook page, Councilor Bassan's Facebook page, she's just doing a spectacular job promoting this event and the importance of it. And it's really kind of a coincidence that it's in a time where some of the things that have just recently happened. So the more gun locks we can get distributed, the better off we'll be. Each location will have 500, and we're hoping to give them all away. And I think that's it, unless anyone has any questions.
Okay, seeing no questions, I hope that your events will be very well attended and that all of those gun locks will be used by everyone who needs one. Thank you.
Thank you, Madam Chair. And if I can, I just noticed that I probably should just talk about the sponsors. So again, we have Albuquerque Public Schools, the Albuquerque Police Department, Eagle Grips, the APS Police Department, the American Federation for Suicide Prevention, and the National Shooting Sports Foundation, Project Child Safe. So thank you.
Yeah, thank you. Thank you for acknowledging those sponsors. And now moving on to our second item of new business, Community Connections, Supportive Housing Expansion Approval. Margarita Chavez Sanchez to present. Take it away.
Madam Chair, councilors, commissioners, school board members, thank you for having us this afternoon. Today, we're excited to come to you with the expansion of an existing program that we have in the community, addressing one of our very vulnerable, if not the most vulnerable population we serve through the Behavioral Health Initiative. So it's been about 2 months that we were asked by Chair Piscotti and County Manager Julie Marcus Baca to really work on identifying some funding for housing supports. As you all may remember, there were some newspaper articles related to addressing the needs of families and those that were seeking motel vouchers and additional supports. So we quickly began looking at what we could do to support those in our community, particularly those who are homeless, living with behavioral health needs. And as opposed to dedicating funding to additional motel vouchers, we felt that it was best to really look at permanent supportive options. Fortunately, we have a great partnership with County Housing Department, and we're able to build upon a program that has been established for a few years through the Behavioral Health Initiative. So in a way to not steal all of her thunder, I'll let Betty kind of talk through this expansion of this project. And we also have a subcommittee chair, our housing subcommittee chair here to speak to the work that's being done in the committee. But Betty, you want to go through the overview and then I'll be here to back up too.
All right, thanks, Margarita. Madam Chair, councilors, commissioners, and board members. My name is Betty Valdez. I'm the director of Bernalillo County Housing. And I'm here, our request is for approval is for $1 million. 750,000 of that will go to the voucher program and 250 to the case management. So I'm going to speak to the housing voucher program that we currently are administering in Bernalillo County Housing. So it was turned over to us, or we, Margarita and I partnered with this and took it from behavioral health and started managing it in June 2020. At that time when we received it, it had 116 vouchers and the subsidy was about $54,000 monthly. I'm going to fast forward a year to June of 2019. We had taken that to 158 vouchers, and our monthly expenditure was $134,800 approximately. So I'm going to fast forward you again to today. Right now, we have 186 vouchers out, and we are expending about $144,000 monthly. So from January, for the last 8 months, our budget is 1.3 million. We have utilized 1,100,000. So you can quickly see how fast we grew this and how much we're expending monthly and how much we've expended in 8 months. So our ask is we'll support about 64 new vouchers for this program. And that's based on an estimated rent of $772. And I apologize, that's not just rent, but we are paying application fees, deposit fees. We're paying whatever it takes to get them in the unit and to keep them in the unit. So that $772 month per voucher is an average of all of that expenditure. So if I've missed anything, Margarita, I will turn it back over to you, or I stand for any questions.
Sure, thank you, Betty. I will just add that as Betty's team has really grown this program, this was a program that actually started out of MDC and came to behavioral health, and we quickly partnered with housing because we knew we were not in the business of issuing vouchers, and we had to defer to some of the experts in the county. And since, as Betty mentioned, we really have worked to grow this program, and her team has done an amazing job. Just take this chance to give kudos, Betty, to you and your team for all the work to get us up to where we are now. During that time, right, we've really worked hard to create awareness about this resource. And we've done such a good job that the waiting list has really, really grown. And so as a way for us to really address that waiting list, herein lies the ask, right? So the expansion to the program for additional funding in order to add these additional vouchers. Now, this Community Connections program, it's a scattered site supportive housing model. It really, to its core, is the definition of supportive housing. While we know the voucher is critical, We want these clients to be as successful as they can, and herein lies the supports. So we don't just want to say, hey, we're going to pay your rent and hope that you're okay, but we're going to embed that case management support. So it is a requirement that all of the Community Connections clients pair with a case manager. They meet at least twice a month. They connect on things like, do we need to get you enrolled in Medicaid? Do we need to provide food supports for you? Can we help you write a resume? Let's work on these different social service-based needs so that the clients can be successful. It's important to also note that the Community Connections program is not exclusive to single adults. It has the ability to house families or couples based on the eligibility criteria. We do have a focus also on allowing eligibility for transition age youth, because we know that's a very vulnerable population. That was also a piece that was added to our criteria as we saw that need grow in the community. And so, as Betty mentioned, this is a $1 million expansion to the entire program, inclusive of vouchers and those additional behavioral health supports. Madam Chair, if I may briefly turn it over to Michael, who is the chair of the Supportive Housing Subcommittee. This may be kind of also related to a later agenda item about subcommittee members addressing the commission, but we wanted to have Michael on because we believe it's very critical for us to ensure that we have that meaningful community input, that the subcommittees are vetting these projects and providing input on any appropriation of the funds that we have. And so Michael, I would take this opportunity for you to speak to the work that's been done in your committee around this proposal.
Thank you, Margarita. Madam Chair, councilors, commissioners, board members, thank you for the opportunity to just share a couple of minutes with you about the support that our committee had for this proposal. Actually, it was the second time that we reviewed the proposal. The first time we were concerned because the money was there for the vouchers, but there didn't seem to be the resources there for the behavioral health case management services that Margarita explained are so essential to making this work. So we asked them to come back. They came back with the proposal that is now up for consideration, the $1 million, $750,000 for the vouchers, and $250,000 for the behavioral health case management services. As somebody who works with the homeless population, it's a pleasure for me to see this kind of work, and also as the chair, just to see this kind of work being done by the county and city collaboratively to really house, up to 250 people with this voucher program. And again, the services that go with it. And I also want to applaud Betty and her team and note that they somehow miraculously, despite the fact that rents are increasing dramatically in all communities, including here, have been able to get the average rent payment that they're making through the voucher system down. So congratulations, Betty, for doing that. It's phenomenal. So the committee is highly supportive, unanimously voted to move this forward and recommended to you. Thank you.
Thank you. Commissioner
Madam
Casada,
I'm sorry.
I see Commissioner Casada has his hand up. Is there a question you'd like to ask now, or?
Yeah, I mean, basically, I think they've kind of presented that, and I just have some questions based on an experience that I'm going through right now. I have a friend who, and I'm using him as the example because I know there's probably more of him out there. I have a friend who's a musician most of his life, and then he ended up in a bad accident where he ended up being disabled, and he now receives disability at $700 a month. So he wasn't able to live anywhere. By the grace of God, my brother was able to get him to stay at the Madonna on the campus where St. Pius is. And I think we're all aware that St. Pius is selling, and they've sold the Madonna. And so now he does not have a place where he's rent free. They gave him free rent there. And now he's trying to navigate the system and figure out how he's going to live. He only receives $700 a month in disability. We all know that is not, that he's not going to be able to survive on the street with that. He did take on a part-time job. And so these are some of the unfortunate problems that I think that are happening in our community. He's only able to make X amount of dollars on his job. And although they loved him at his job and they wanted to give him promotions and they wanted to give him raises because he's bilingual and he was able to do phone work, and he's like, wait, I can't do that, because if I make a penny over the amount they allow me to make, I lose my disability payment. And so I want to ask the question to whoever could answer this: what's his options? What can he do? He's going to be out on the street in, I think they sold it. I think they're giving him 6 months. And so he called me and says, what are you guys doing to help people like me? And I told him, I don't have an answer to that. And I knew we were going to talk about housing and how we're supporting people in this meeting. And so I thought I would hang on to this question and see if this could be part of our discussion, either after they're done or even right now before they finish. And so we can see, so not only can I answer that question for my friend, but my assistants would be able to answer that for constituents who call us and us help them guide them through the system.
Margarita, do you?
Because wait, let me end with this. Because the system is supposed to help people with a hand up, right? And it's supposed to help people grow. And because you talked about that, right? You talked about supportive services and that we want to be able to get people, and that you have to go see a case manager, and we're looking at resumes and jobs and working. But a lot of them are afraid to do that because they're going to lose whatever benefits they have. They're going to lose whatever is coming in. I don't know if we got to change it at the state level to where you can counter the money. So if he makes over the amount, that they maybe take less from, or give him less for his disability. And then it's because if he loses his job and he loses his disability, then he has to start over. And it took him 5 years to get disability. And so I know these are hard questions, but if we can answer them or help me guide us to how we can respond to these.
Okay, and I know a lot of people are in that sort of situation. Margarita, do you have a suggestion for that?
Madam Chair, Commissioner, I think this is by and true one of the issues that we see very often, right? Especially with our behavioral health population. They're navigating Social Security, disability benefits, whether they can work part-time, full-time, what that looks like. And I think really the big piece is it emphasizes the critical importance of case management, right? Our case managers work with our clients based on their unique situation, because there's no one size fits all that fits for everyone, right? He may honestly have a disability that prevents him from going on to that next step. Or if he can find him a great job that he no longer needs that disability check, right? There's lots of different pieces to identify. Betty, I'll let you kind of chime in on housing resources, but I think it's important to understand that part of the reason that we're really looking for this expansion of community connections is that housing resources in the community are very tapped, right? They're very tapped and they're very stretched, I guess is maybe the best way to say that. And so it is one of those situations where we want to have an opportunity for our case managers to work with our clients, to build a transition plan and a success plan for them that's built off of their needs. This gives me a quick segue into an update that I have for the later agenda item, but I'll mention it now, is that the county will be launching at the beginning of April our community engagement teams. And the community engagement teams are essentially peer case management, peer support models. And so this would be a perfect opportunity to say, CET, community engagement teams. I have a client who needs some help, and that case management team can wrap around him, help him get connected to those services and those long-term supports, right? Be it addressing housing needs, be it addressing, income needs, be it food insecurities, whatever those supports are that are needed. Betty, anything else that you'd add to that?
So yes, I guess, Madam Chair, Commissioner Casada, what I would like to say is what Margarita just piggybacking off of that, the housing resources are tapped out in the environment we're in. For instance, my Section 8 voucher program, we're at 98%, and I know Commissioner Piscotti, you recently got an email from HUD saying what a good job our team did. I try to lease up to almost 100%. I don't have a voucher available. So I know County Manager Morgus Baca and I have talked about possibly next, and Clay, about maybe the next round when we go to our legislators, our representatives and our senators in Washington, that we ask for more voucher money, because that hasn't come out in the 15 years that I've been at Bernalillo County Housing. They have not increased our voucher money. They've cut it. So that's always a challenge for us. This program in particular, Commissioner Casada, is for behavioral health, for mental, I don't want to say mental illness because there are some other disabilities in there, but, and for the homeless. And we have 700 people on our waiting list. And that's when we took it over. I think there was like 130, but that tells you the need right now. And it's just a tapped out housing dollar economy right now. And we're looking and struggling to find resources to take care of exactly what you're talking about. I feel like that's my job in the community, but I'm trying to do it chasing dollars or maxed out in a program, and it's growing the other way on the waiting list. So I wish I had a great solution for you and say, call me, I have a voucher, but I have nothing right now.
Yeah.
We do the linkages program with the state and the Mortgage Finance Authority. That's for homeless and disabled, tapped out. I have the Veterans Homeless Program and the mentally ill, tapped out. So I'm looking for dollars and programs all the time, but everything, the minute I get it, it filled up and there's a waiting list behind it. So I'm so sorry, but I don't have a magic wand or a voucher to say, yep, have them call me, because everything is full right now.
Thank you, Betty. Excuse me, Madam Chair. And so the thing is, so the problem is, he is bipolar. And so he's being diagnosed with that. And so it's really hard for him to let go of his disability, his little measly $700 a month, and take on a job, because we just don't know if he can navigate that long term, right? And again, I think he would be, I think that he's at a point where he could probably work and use that money and be successful and find something, but he's not willing. He's so afraid that he's going to make too much money. And so what I'm asking us is there something we can put together to approach Santa Fe about looking at, for people who actually can get a job and get paid and climb the ladder, but still not lose their benefits? Is there a way we can, put them on hold or put them on pause for people who have a behavioral health issue, instead of just kicking them out once they've made too much money and then they lose their job, right? And I'm afraid that's the category he's going to fall under. He's never been very successful with holding a job. Like I said, he was an entertainer. So he really didn't have that experience on holding, a permanent type of job. But now he's in this job, he's doing really well. And a matter of fact, he just got accepted on the waiting list for the union, the 480 in the movie industry, because he knows painting and he knows other stuff, but he can't do painting. He's disabled. But there's other jobs in the movie industry that he could possibly do, being disabled. But he's so terrified that he may not survive it. He may get fired, and then he lost his benefits that he waited so long to get. So I'm asking us as a group, is there something we can put together for Santa Fe? Also, not only asking for dollars, but looking how we fix the structure of how we believe the difference between a handout and a hand up is. Because there's a difference. And I think we all agree that we want to teach somebody to fish, right? For those who are able to do it. I'm not speaking for everybody. I know not everybody can do that, but he's the one person I think is the prime example of somebody who can do it if he felt comfortable with the supports behind him without the system punishing him, right? The system that's supposed to help him punishes him if he tries to make that transition that we all want him to make. We all here on this meeting want him to make that transition. We all want to call him right now and say, take the job, man, take the promotion, take the raise, but we're not in his shoes, and we don't, and I can't convince him otherwise. And so he lives in fear of where he's going to go. And is he going to lose his disability benefits? He did have a section, he had a Section 8 voucher, and he let it go because he felt there were single moms out there that could use that more than him, and that he was blessed to be staying at the Madonna for free, and that he didn't want to tie up that, that voucher to get into housing. So he thought a single mom could use that over him because he's just a single guy. And so he let that go. So he's already made sacrifices, I believe, but he's not willing to make the ultimate sacrifice and lose that money. So maybe we could put our smart minds together and come up with a way that there's a way that we can leverage the system, so the system works for people, so he can make more money and have confidence in making more money, knowing that if it fell through or if it goes bad, that he can somehow go back to his $700 a month and maybe go find another job or whatever, but knowing that he could at least pay his rent, whatever that may be. We're looking for something that's a lot cheaper than $700 a month for him. And I'm telling you, that's just as impossible as, especially as we talk about the markets now. That's like a tough shed, with, on no land, that would charge you $300, $400 a month, and leaving him $200 to feed himself, So these are the dilemmas that we're facing, for our community. And what can we do as elected officials? What can we do as a body with ABC, GC plus APS, and look at what kind of legislation can we present to our leaders in Santa Fe to say, hey, these are the challenges that we're facing within the system. I know some of it's federal, but some of it's state too. And, and how do we fix this? How do we get ourselves to a point where people feel comfortable about trying to improve the status of their life without threat of losing what benefits they do have? And now I'll be quiet. I'm sorry.
Margarita, did you want to answer that?
Sure. Madam Chair, Commissioner, happy to really begin working together to come up with a solution. I think in the very short term, let's chat, because I think if your client really does have or your friend really does have an underlying behavioral health condition, let's make sure that he's on all the right waiting lists, like Community Connections and others, and ways that we can have our case management team work with him. But long term, absolutely, I think this is something that we can work. Manager Baca, if we're able to work with our legislative lobbyists and our local and federal on ways that we can address needs in the community. Sometimes it's not even necessarily something that we need to work on addressing for legislative change, and we can look for reg change. But happy to really start working on ways that we can address that situation long.
Thanks. Counselor Sena, I know you've had your hand up for a while. Go ahead.
Yeah, thank you for that, Madam Chair. I think Commissioner Casada made a great point in some of our discussion about some of the barriers that community face when they're trying to access vouchers or even just housing in general. And as we're asking Santa Fe on some legislation and some help, I think I was tracking House Bill 111 as it was trying to address some of the barriers we were seeing. But without it passing, some of the barriers will still be there. So love to see, whether we as a body come up with some more suggestions that would be helpful to Santa Fe to say, like, these are some of the struggles that we're seeing and we need real legislation from the state to address that. But my next question, I guess only question really, is as I was working through some of these processes and hearing some of the struggles that community was facing, it was, they were living in their car with a housing voucher, but couldn't afford their security deposit. So I guess I heard from Ms. Valdez that $772 a month amount also includes the security deposit and all of the other fees that are associated with housing. Is that correct?
Yes, Councillor Sena, it is an average of the application fees and the deposits and the rent. It's a cumulative over and of, we've been tracking this since we took over it in June of 2018, and it's just an average of that. But I would like to add right now, if for anybody on this call, we have a partnership, and I'm not sure if they're taking on new partners, but we do have a partnership with Catholic Charities, and Catholic Charities is paying for our deposit and application fee for those on our programs. And I'm not sure if they have it available outside of that, but I don't know all of the specifics, but that might be a resource for your application deposit fees for those that are needing it.
Thank you. And Commissioner Barboa, you're up next.
Thank you, Madam Chair, and Commissioner Quesada for this important conversation, right? And for the Behavioral Health Initiative folks presenting, Betty. I think, right, that well, one, I would be interested to know but I believe that like those dollars come from federal money, so there's not a way to shift when people get penalized, at least not locally or statewide. But I do recall as I was a young parent and in school, I did have my Section 8 voucher, and I had a work study job. And because that work study job was a federal job, it didn't impact my receiving Section 8 and it didn't impact my other. So I wonder if there's workarounds there, if there's a federal job program we could work for. I also really think this makes me think of, right, because we hear this a lot among folks going through very much the same situation that Commissioner Quesada is talking about, but also our folks, differently abled folks, right, that want to work, maybe can't work full time, or also are on disability and they want to work and feel like they have meaningful things to do with their time and maybe earn some extra cash, because that disability funding definitely isn't enough, right, for folks to live comfortably. So I think there's like a job market there that really works towards those folks, making part-time jobs available that are within the means. I hate to think of the thought that anybody would have to give up their disability, because that's hard won, right? That doesn't come easy. And they shouldn't have to even balance it out, in my opinion, because that's such a small amount of dollars to try and make it through the month, that if somebody's working, it's because they need more, right? Or they want to be doing meaningful work. But So I just wanted to add that conversation about like when we think about the economy and jobs and how we're meeting these folks where they're at, like how are we actually putting it on some of the responsibility of like, hey, can we create employment that is conscious and aware of this need that does both, doesn't harm, but gives people meaningful. And sometimes, right, they know that sometimes those jobs have been seen as being paid under minimum wage. That's also, we also have a history of folks doing that, which I also am not suggesting or advocating for. But I'm definitely of stuff that is definitely of interest to me. And yeah, I just wanted to make those comments.
Madam Chair,
Yes, Counselor Pena.
I apologize. My raised hand function for some reason on this laptop doesn't work. But I just wanted to kind of reiterate what Commissioner Quesada was saying, and just really listening to the conversation. You know, I know we're all, you know, just really trying and struggling to do our best to try to address this issue that's ever growing in our community in terms of homelessness and people with mental health issues. And you know, what just occurred to me is that maybe as a group, we should really look at, you know, we have the DD waiver. It's a very expensive model, but there's aspects of that maybe we could look at to help people with mental health issues. And there's job coaching, and there's opportunities there, and there's opportunities for housing. You know, part of maybe with this gaps analysis, just identifying how we can kind of come up with a comprehensive plan for people's success, because that's exactly what the DD waiver does. You know, it really helps people who are developmentally delayed or intellectually delayed, whatever people, the term that people are using now. And it really provides them all those resources individually to help them to live independently and to be successful. So I think it's food for thought. I mean, it just, you know, because we have all these programs and different programs. And as Commissioner Quesada said, I've been confronted with the same situation, having people, I think I mentioned a couple of meetings prior that I have a young lady who has some mental health issues, and she has her master's, and she was doing social work for many, many years. And unfortunately, her mental state, you know, got the best of her, and now she's on the street, and she's just really bouncing from program to program, trying to identify how she can get the help that she needs. In the meantime, she's homeless. She's unable to secure employment. So you know, it's just food for thought. And I appreciate, you know, this conversation. I think sometimes, you know, we stick to the agenda and the items on the agenda, but I think these conversations are helpful to lead us to the path to support residents in our community. And then I'm going to end on a light note. I know Adrienne had a baby with her, and then I don't know how she passed that baby on to Margarita. And then now Ken landed up with the baby. Thank you, Madam Chair.
Okay, and let's see, I know Commissioner Benson, you've been waiting for a while. And Adrienne, I'm going to look in your chat while Commissioner Benson goes and see what your question is. Go ahead, Commissioner Benson.
Thank you, Madam Chair. I just want to reiterate, I don't want to belabor the point too much, but I think Commissioner Quezada, Commissioner Barboa made great points. And actually, the Commissioner Barboa just describing as being a hard-won benefit is true. And to Commissioner Quezada's point, these folks are disincentivized to work. Why would they? If they're going to lose this extremely valuable, hard to get benefit, you're telling them to take a gamble, especially if it's a behavioral health issue like bipolar disorder. So, but then to Councilor Pena's point, knowing, what we can do locally on that issue, and Commissioner Barboa being a federal benefit, but then doing the local benefit, Councilor Pena, I'm sure you're aware, the DD waiver is a wonderful program, but it also has a 15-year wait list. The demand is just incredibly high. And actually, I think the 15 years is outdated now. I think it's closer to 20-year wait list. So Margarita, I'd love to hear like what we can do to research how to help these folks keep their benefits, get them employed, get them housing. Maybe there's a way to kind of tie different programs together that work well with each other. Yeah, it's not supposed to be this way. That's all.
Madam Chair, Commissioner, to address your question, I think there's a lot of work that we can do on researching the processes, what the regulations are federal and locally related to those funds. And I think how do we come up with innovative strategies, right? That's unfortunately what we do best because we don't always have a whole lot of money flowing at us. So we come up with innovative strategies to partner with organizations and partner with local groups. We've worked with Workforce Solutions on identifying ways that we can plug folks into appropriate employment. There's lots of ways for us to look at those partnerships. So as I mentioned earlier, I'm happy to really start working and maybe creating a little small working group to address this issue in the community, and it may grow above and beyond just addressing disabilities, like something that we really see at the Department of Behavioral Health Services and through our crisis stabilization unit is clients who were never put submitted for DD on the DD waiver list, right? And now they're so far back on that list, but they can't access the supports provided by the DD waiver because that waiting list is longer than the waiting list that Betty has. And so there's a lot of those types of issues in the system that we need to work to address. So happy to start working and coordinating. Madam Chair, if it pleases everyone on the ABCGC, I can kind of circle back in at our next ABCGC meeting with an update on some of those next action steps and what we're looking to do in pursuing that addressing that result.
Thank you. And, Margarita, while you have the floor, I'm just going to read you Commissioner Barboa's question, which you probably saw in the chat. For the request for community connections funding, it was said that case management is a requirement. What happens if people decide not to participate in the case management?
Madam Chair, Commissioner Barboa, I hope you saw my response in the chat, but just for the record, this project is not a housing first model, and it's specifically tied to that case management intentionally to provide that support. There are a number of other programs in the community that are housing first that don't have that case management support. The literature tells us that for the behavioral health population, that support is vital. And for folks who don't need it, they may not necessarily be eligible for the criteria and meet the criteria for the program. So the very long answer that should have been short to your question is that any clients who, when they begin the program, they acknowledge that requirement and accept that requirement. If that changes and they become non-compliant with that program, the team begins to start working with them to address maybe the issue that they are now non-compliant with this expectation and working with them to get them back in that compliance. If it does progress significantly and they continue to refuse that level, then they would move to termination in that program, and we work to transition them to other supports.
Thank you. If I could respond just real quick, I know other folks have their hand, but thanks, Margarita, for sharing that. I do, as a case manager, I believe in case management as such a critical need for so many areas of our community. And I believe that human capital is so important to almost any success, whether it's in the education, in your healthcare, like having someone to help walk you through and navigate the system is critical to success. But when we make it a requirement, and this is way often like within the criminal justice system, when it's court ordered, that just that relationship alone of being a required and having penalties that come along with the requirement is not is also, there are lots of studies, right? Like how people receive that because of it being a requirement that also comes with like negative consequences. So agree, I'm glad that they're there. I think those dollars are worth every point. And I do think that there's some pieces around the approach and the penalty deterrent piece that could be just, ironed out as far as, what that relationship looks like. It's how we set up the relationships, how the success follows. So just noting some of those pieces. But thank you.
Madam Chair, Commissioner, we totally agree. It's absolutely about the approach and ensuring that all the clients know that we are partnering with them and we are working with them for success. It's not intended ever to be a punitive relationship or be something that's seen as court ordered, right? So it is very much about the way that that's approached. We've had very little over the last 4 years, we've had very few incidents where people have become non-compliant and moved off. And actually in those situations, it was because their behavioral health need got so acute that they needed a higher level of care anyways. But nonetheless, it really is about, to your point, that relationship. And they create that rapport with the case manager with which they're paired, and they become, allies and advocates for each other. And so again, that is an outlier, but completely echo what you're saying. It really is about the approach and the rapport in
Okay, thank you. You you went mute there, but I think you're finished, Margarita. I see Counselor Davis has his hand up, but I wanted to ask Betty, did you have something you just wanted to address, answer a question that was asked? If you have something brief, please go ahead.
Thank you, Chair Piscotti. I just want to assure you that for those that are on disability, and that is many of our program participants on Community Connections and on all of my other programs, we do not kick them off. How that happens, what happens is they get their Social Security or their disability, and they start, if they want, becoming employed, if they can. As that income increases, we decrease our rental subsidy to them. So, I understand that there's federal requirements and how much they can make, but we don't say in order to have housing, you have to get rid of your Social Security because now you have another job. What we start doing is looking at it collectively, and we start reducing rent. And I've heard some ideas out there, but in our agency, and I think there's only 2 in the state, but in Bernalillo County Housing, we have a self-sufficiency program. And what we do is we do partner with CNM, UNM, other employers, so that if their goal is to reduce their subsidy, and not be on the housing program or in other systems, then we're working with the community to increase their wages, not get rid of their disabilities or Social Security payment, but to increase their opportunities. And at that time, we're reducing our rent as they're increasing. And our successes are, we've seen several graduate from CNM or get jobs. And oftentimes, many of our program participants are disabled, either mentally or physically, and they cannot earn a full salary, as Commissioner Quesada said, and go paint. But we often see them when they are working. It increases their morale. We see them grow, and at the same time, we're reducing our subsidy as their income is growing. And not too often, I can only think of 2 instances in the last 15 years, has it grown large enough that they've not been on the program. So I want to assure you that we do not say you have to get rid of your federal income. As we're seeing their outside employment or their private employment grow, we're reducing subsidy, not figuring out a way for them not to work or not get this other income. But we do have that opportunity within our agency that if they do want that opportunity to grow, then we're going to supply them resources to do that with our self-sufficiency program. So thank you, Chair, for letting me just jump in there.
Yes, thanks, Betty. And Counselor Davis.
Thanks, Madam Chair. I didn't expect this conversation to go this long, but I'm really glad it did, because I still think this is the most important issue we have in our community right now. And let me start by saying, and I'll keep it really short, I really want to commend our county manager and our commissioners and the staff for taking this on. I have been on, I can't tell you how many calls with our county partners about ways to figure out how to collaborate and work together. And I'm curious if Betty can help me just a little bit, because I'm so interested in where the county has found a way to work on this case management housing model. We do a very little bit of it at the city, but at the city, we've heard some concerns that, for example, when we said we really wanted to put that $2 million that we allocated last year that went unspent out into this model, we were told that there's not a community capacity for enough people to help with the case management. And so that wasn't a model our community could support. But I hear the county saying it worked and they're asking for $1 million to continue it. I wonder if you could help us understand a little better about where you're finding partners for that case management work, because I agree with you. The data, the anecdotal and the scientific data tells us that housing first is important, but we've got a big chunk of folks that need that daily help, and we've seen that work really well. Could you tell us a little more about where you're finding the right partners that are helping with your model?
Madam Chair, Councilor Davis. Sorry, Betty, is it good if I take that one?
Yeah.
Okay. So we have some amazing partners, two of which are specifically attached to the Community Connections program. Is Crossroads for Women, which has been one of our partners from the beginning. They do amazing work. They're also one of our peer case management providers. So they provide kind of that robust case management in our Community Connections and in other levels as well. Our other partner for our Community Connections program is UNM. So we use a function of the University of New Mexico Hospital, who hires the case managers and provides that support. This Community Connections model is a collaboration with the City of Albuquerque, and the City of Albuquerque does provide some of the vouchers out of the original program. Betty, correct me if I'm wrong, but I think it's 50 vouchers out of the original program from the City of Albuquerque. And they also have a few partners, but we have been really fortunate in working with Centro Savila, YDI, New Day Youth Services. There are a number of providers in the community who have case management capacity. We also have hired a number of case managers as a part of our department. And actually, these are positions that we get tons of applicants. A lot of people are applying for these jobs. And so I think that there really is capacity in the community to meet the case management needs. It's really about funding to cover the cost for those case managers. We also have really worked diligently to make sure that we are focusing on peer case management, right? Recruiting peers who maybe have experienced homelessness in the past. Maybe they have a behavioral health condition that with lived experience, or maybe they're in recovery. Because a lot of times those peers bring an additional layer of knowledge to the case management work. We've also worked really hard about ensuring that our case managers get paid a good wage. And that in and of itself also really helps with recruiting.
Thank you, Margarita. Was there any?
Oh, Madam Chair, I just wanted to say thank you to Margarita, if that's okay. No, that's perfect. And I just might suggest that, not to prolong this conversation, but I think what you all, Betty, you and Margarita and your teams have done, and the Crossroads team from their evolution, from their early amazing MDC work to community work is amazing. I just might encourage us as this group to think about how we might more deliberately split our housing efforts. And I do think the county has figured out a really great way to do this case management model. And I think the city is doing a really great job at doing the rapid emergency rehousing work that we're doing. And so I think that might be a good place for us to look at how we divide and conquer and support each other's work in a more deliberate way. Not that it doesn't happen already, but I do think it happens a lot more, as Margarita sort of alluded to, at the staff level of, hey, handing this person off to that program. I think maybe we ought to think about how to formalize that in our budget processes as we go forward into this budget cycle this year. Thank you, Madam Chair. I appreciate the extra time.
You're very welcome. Isaac Padilla, I see you have your hand up. Go ahead.
Hi, Madam Chair. Thank you. I apologize, my video is not on, but I'm having problems with the internet. Ms. Valdez, I have a couple questions. You said that the county has all their Section 8 vouchers, or all the vouchers that are they're fully utilized right now. Is that correct?
So we're allowed to lease up to dollar amount or voucher number of vouchers. So we are at capacity with our dollar amount, our funding from HUD, yes.
Okay, and I think it's important for most people to know that you're not the only organization in the city or the area that offers Section 8 or offers these vouchers. Is that accurate? And if that's true, who's the other organization that does allow that? Or does offer?
I apologize. So yes, we're not the only housing authority. There is the Albuquerque Housing Authority, but I do not know their I don't know what they have available. I'm an agency and we don't share that information or funding by the federal government. So I'm not sure their capacity right now.
You guys, I apologize. My internet went out again. I'm not sure if you can hear me.
Yeah, you might be going in and out. Do you have another question?
Yeah, I think, Madam Chair, thank you. I thank Commissioner Casada for bringing this up, but I think it would be really important to ask both agencies to come forward and talk to us about housing, talk to us about vacancy rates, where it comes to not just vouchers, but the number of the number of apartments that are available with both agencies, so that we get a better understanding of what's going on.
So if I could just respond. So we have multifamily units, and I'm speaking just for Bernalillo County Housing, that are for elderly and seniors, and those are completely leased up. And we have a waiting list for those units of about 200 right now. So other than that, the city vacancy rate, if we do that, I'm sure Linda and I work well together, and we would be happy to gather that information for you. But within our units, we only keep that vacancy rate within our units and not outside of that. So just for information, if we're going to put this together, we would need some expert on the outside rental community.
Madam Chair, I apologize. My internet's going in and out. No, maybe I can follow up with an email and just see if we can have the Albuquerque Housing Authority maybe present to this body so that they can.
Okay, it looks like we lost Isaac Padilla again. So we've had quite a good discussion here. And so I will, it's time to vote on the Community Connection Supportive Housing Expansion. So I will move to approve. Do I have a second? Thank you, Commissioner Casada. All in favor, say yes. And thank you. And Julianne, can you please call the roll?
Sure. Commissioner Benson,
Yes.
Counselor Davis,
Yes.
Commissioner Barboa,
Yes.
Counselor Pena,
Yes.
Commissioner Casala,
Yes.
Counselor Sena,
Yes.
Madam Chair Piscotti,
Yes.
and Director Isaac Padilla. I see he's unmuted, so that's so called. Thank you.
Okay, thank you. So it sounds like that passed unanimously. So moving on to old business. Counselor Pena, will you be presenting on Youth Suicide Prevention Collaborative update?
Thank you, Madam Chair. I will start off and then I think I'm going to turn it over to Dr. Muir.
Okay, thank you.
So I have some notes here just saying, Dr. Muir, as I stated earlier, asked the ABCGC plus APS group for help in forming a collaborative between the city, county, APS, and UNM to find solutions to this preventable issue of youth suicide. The city and APS began meeting as a youth suicide collaborative. Our partners include myself, Councilor Bassan, Dr. Muir, Vicki Price, Layla, don't want to massacre her name, from APS, students from El Dorado and Volcano Vista. So far, we've had 2 organizational meetings, and I kind of briefed you on them earlier. But I did want to say that, at our last meeting, which was our second meeting, that we really talked about who are the additional people that need to be at the table, who are the stakeholders, both city, county, APD, or different nonprofits. So we're actually working on that. As I mentioned, Councilor Sena wants to participate. Anyone from the county want to participate, more than welcome to have you join us. So the collaborative has prioritized the following for our work this year, and it's been youth-driven, as I had mentioned earlier: awareness and education campaign, REACT, which, who came up with this, Dr. Muir? I think it was Rachel, right? Recognize, educate, act, connect, talk. And then awareness and stigma breaking for youth, parent engagement, community training around prevention and intervention, gaps analysis. And we really talked about the gaps analysis that's being conducted right now, and if there was a need for us to utilize that opportunity to look at a gaps analysis for youth services that are out there. And how do we identify folks who need to more connectivity? And then how do we connect them? Focus on supports and already established groups to connect students and families with resources. And, with that, again, it was Dr. Muir who brought this to the ABCGC plus APS. And I'd like to turn it over to her because she's really the expert in this and has been working at it a lot longer than I have. So Dr. Muir.
Thank you, Councilwoman Pena. Yes, we brought this to you, and I'm very grateful for the Councilwoman because she kind of took the bulls by the horns and said, let's start meeting and let's talk about it. Our first meeting, we didn't have as many people as she identified. And the second meeting, we had more. But in both meetings, the youth came, and they have really helped drive what this is. If some of you may remember when we brought this to you all, I know some of you are new since we did our plea, because it was sort of before COVID happened. We did a plea for a collaborative, and we wanted to make sure that it truly was a collaborative, that it included as many people in the Albuquerque Bernalillo County area as possible, because it's not just one entity's issues. You've heard, about a lot of information on the behavioral health funding, those kinds of things. And we wanted to come together and say, how can we work together to prevent youth suicide? Because we still are, unfortunately, leading the nation. And this is not a good thing to be number one in. And we want to curb youth suicide. So as we came together, the last meeting was extremely productive. Councilwoman Pena said as she mentioned, we came up with some very hard, we brainstormed a lot. We came up with the top priorities for this year. That doesn't mean we're ignoring the other things that we brainstormed, but we want to start with a youth-driven campaign. We've already got a slogan. And then the other thing is to work on the gaps analysis. The hardest part that we're having right now is getting more people involved. And I really want to put a cry out to the county. We really need some representation from the county on the collaborative. Right now, we're meeting once a month. That may change. It just depends on how, what we decide we want to do. If we break off into work groups to get things done that we want to accomplish. But right now we've been meeting about once a month as I've actually was able to get the state to join us. So both the Department of Health and the Public Education Department will be joining us in our next meeting so that we can learn from what they have and they can learn from us, because I know they're trying to do a statewide collaborative around suicide prevention. And so we're hoping we can work together with them. And we have some other people that we've asked to join us. I believe that board member Armijo has volunteered to join the collaborative. So we now have a board member also on the collaborative. But I'm going to tell you, one of the biggest gaps we have right now is the county. So we're hoping that some people from the county will consider joining the collaborative so that we can work together, that you all can figure out in terms of the gaps analysis, what you're doing right now and how you might be able to expand that to look at what's currently out there for youth, specifically for youth in that gaps analysis, so that as a collaborative, we can address those gaps that exist, try to build those for our students. So I think that kind of sums it up. I know that Council, I want to thank her so much. She's really pushed this. Out of that came her other report. So the reason that APS is partnering on the gun lock distribution is because it is a great way to help prevent youth suicide. And so we're using that as part of our initiative to prevent youth suicide. And we will be there. Vicki Price and I and a few other people from APS will be there on Saturday supporting the gun lock distribution. So I think that we're already starting to move on some things, but we really need more people. The youth are driving this, which is fantastic. And I'll stop and we'll stand for any questions that you might have.
Thank you for that presentation. And I saw that Margarita has already put in the chat that she's happy to participate on the county side. And yeah, and I think you might have more people signing up as they hear about this opportunity. So thank you. Are there any questions? Councilor Sena.
Thank you, Madam Chair. And I do want to thank Councilor Pena for also inviting me. You know, I brought this up in a conversation with her. And when we're thinking about preventing youth suicide is really the component of the behavioral mental health. I do worry for especially our students as we open up soon, that be a big component of this overall conversation, checking in with our students and how they're feeling, but particularly Asian American students report the highest rates of self-harm and thoughts of suicide. And this is why I broached the idea to Councilor Pena. And with the recent events in Atlanta and the tragedy there, that I have a lot of concerns for not just our Asian American community, but specifically our youth. Quite frankly, the rhetoric over the years has caused a lot of our community to be specifically targeted and scapegoated. So I hope that this is a major component of this conversation, and that I also hope that some of our partners on this call at APS are also prepared with really action plans. I know I'll have a community event this weekend to address some of our community's concerns and really their fears I mean, we're hearing of family not even wanting to open up their doors to receive meal boxes in fear of being attacked. And it extends to our youth especially. So I was talking to Counselor Pena about this, and just really hope that we acknowledge just the overall stress of the pandemic that has been brought upon our youth, but also, you know, as we were opening up, what may occur when we're thinking about preventing this is also addressing the bullying. And I hope that we also don't, you know, over criminalize our students for some of this, but also have action plans ready that if incidents occur within our schools or throughout our city, that we address it properly.
Thank you. Can I comment on that? I'm so happy that you've decided to join the collaborative because it is a prevention collaborative. And so the things that you've mentioned are all preventative actions, things that lead to youth suicide. So I'm really glad that you're joining us. If you know of some specific students that want to participate also, you'll receive an invite from Rachel Hernandez for the collaborative, which is on April 7th. Feel free to also invite them. I know that the students that have been participating are reaching out to more students to participate. Their voice is so critical in this because we can help with the things that they want or need, but we need their voice. And so thank you for being there to help with their voice. But if you have some, please, when you get that invite, invite others to the table. This group cannot get too big. So it's certainly not limited to anyone, and it can't get too big. So the more people that we have on board, I think the more action we can take together.
Madam Chair, if I could follow up.
Sure. Go ahead.
I would love to follow up with you because I would love to have this as an announcement as part of our community event so that our youth can participate. But over the year we've lost a handful already, and it's been a real struggle for our community. And just knowing over the course of the year, with what our community's been facing has been really difficult. So I appreciate that, and we'll follow up with some more details. Thank you.
Thanks. And County Manager Julie Morgus-Baca, I know you had written in the chat that the county is happy to participate and support these programs. Could you just speak to a little about how we have been supporting suicide prevention so far?
Madam Chair and members of the committee, we actually, I believe we're providing funding through our behavioral health initiative for this very thing. But I think what I'm hearing, Dr. Muir, is you're also wanting our participation. And so it goes without saying, absolutely. I know that Margarita, I can see that those wheels are spinning, and she'll be in contact with you, and we will assign somebody to participate. Absolutely.
Thank you so much. And yes, the county is funding a program specifically in APS for youth suicide. It's prevention and intervention program, and we absolutely appreciate that. But this is going sort of the next step. What are the other things we can do to help prevent youth suicide? So thank you so much. And I'll send, I'm sure that I will let Rachel know to include Margarita, and if there's others that want to be included, you can just contact Rachel and she can invite. She's the one that's sending out the invite. So thank you so much to Rachel. I know she's not here, but you can pass it on to her, Councilwoman Pena, because she's really helped a lot to do that.
Thanks. Commissioner Barboa.
Thank you, Madam Chair. Thank you, Dr. Muir. I'm not sure if you remember me, but we worked together before on some of the YRS stuff and school-based health centers. I know that's mostly just a question. What is school-based health centers? Do they currently play a role in behavioral health needs for the schools, at least where they are located?
So yes, thank you for that question. All of our school-based health centers have behavioral and mental health supports. So that is one thing that they all offer. So, and in terms of this topic that we're talking about, the Alliance for School-Based Health Centers also agreed to participate with us. So they're going to be participating on this, but all of our school-based health centers currently offer behavioral and mental health supports as part of what students, and I'm sure that most of you know, and if you don't know, this is a good opportunity. Students over the age of 14 in New Mexico can self-refer for mental health support
37:30.
in New Mexico. So
That's a lot longer than it.
they can go directly to the school-based health center to get those services.
Thank you. Thank you, Madam Chair.
Thank you. And a few weeks ago, Commissioner Casada and myself and Margarita met and we talked about supporting school-based healthcare centers. Was there anything you wanted to add about that, Margarita? And especially the tie-in with behavioral health services and suicide prevention?
Madam Chair, I think it is vital, right? That has been a priority of the county, particularly Commissioner Quesada since our first meeting when he was running for office. The first conversation was, what are we going to do about school-based health centers? And so we're excited. We actually have a meeting with Ms. Muir in the coming weeks to really talk about what that looks like in APS and really embed that. But absolutely, while many of the school-based health centers have behavioral mental health supports, sometimes those supports are limited and can't meet the demand in the schools. So we want to work on expansion of those existing school-based health centers. And there are many schools that don't have school-based health centers or access to school-based health center services. So we're exploring the possibility of mobile school-based health centers that can travel to elementary schools and middle schools and really focus on those underserved populations, underserved communities. We're wanting to work really closely with APS to gather data around what schools have needs, right? Because it's the behavioral health needs are not always mirrored off of socioeconomic status in districts, right? We sometimes see spikes in districts that are more affluent. So behavioral and mental health does not discriminate, right? And so we want to make sure that data is informing how we deploy those services, and a blend of kind of brick and mortar and mobile will help us to stretch that demand even further. And so this is a critical component, Commissioner, to your point, school-based health centers above and beyond what we're funding APS right now for suicide prevention. But also, how do we provide those supports for the families so that the youth can have the support that they need to be successful? So more to come in the next line item, actually, on school-based health centers.
Excellent. Are there any other questions, or should we go to the next item and have Margarita present? I don't see any hands raised. So Margarita, go ahead. Continuing behavioral health initiative updates.
Thank you, Madam Chair, commissioners, counselors, and board members. Thank you for giving us the opportunity to provide this update. I have touched on a couple of my items to present on today, so I will keep things at a high level and feel free to ask any questions. I mentioned earlier that we are excited to be launching our community engagement teams that will go live now in April. At that go live, we will be announcing a phone number. There's been many questions on a number of different meetings that says, hey, who do I call? How can I get help for folks? And so this phone number will be a dedicated number for our community engagement teams that can be called. There'll be somebody answering that line 24/7 and connectivity to a peer within 24 hours. And so that peer can go out, meet people in the community, in their homes, at their workplace, to provide those supports that are needed. We're really excited about the launch. Our partner is YDI. They're actually going to be the provider, the community-based provider that will be providing that service. So we're really excited about that new initiative and that launch. As was mentioned also earlier, is that we are conducting a gap analysis. We have contracted with an organization called Via Positiva. They're a local group with behavioral health expertise, and we are asking that they conduct a systems-wide gap analysis. So we're not only focusing on behavioral health, we're also looking at social services, homelessness services, criminal justice, the largest net we can cast to gather information. And so right now, the first phase of that gap analysis is they are reviewing a number of data and reports and analyses that have happened over the last 5 years, as was requested via the resolution that came through at the city side and in the county side. Once they've reviewed all of that info, they will be reaching out to our partners in the community to understand more in depth what those gaps are and how we can best address them. As was mentioned on public comment, that gap analysis will inform the Department of Behavioral Health strategic plan, which will be renewed later this summer. That is a partnership with the city of Albuquerque. We each have separate agreements with Via Positiva to conduct that gap analysis, but the county's agreement is executed and they're working under our agreement, and I believe the city's agreement is in the final stages of execution. And same goals, same action items in both of those agreements to ensure that collaboration. We have also begun working with the state and federal partners on the national 988 rollout. I'm sure all of you have heard about the National Behavioral Health Hotline and 988 number, kind of like 911 and 311. 988 will be dedicated to behavioral health supports. That will go live in July of 2022. So lots of planning to be done between here and there. The state's goal is to increase statewide mobile crisis teams, increase crisis triage centers statewide, and really meet the needs of all local jurisdictions. So as you all know, the county has been leading the way in the state around behavioral health supports. And so we are providing kind of that technical advice around all of our lessons learned, sharing policies and procedures, and anything we can to help our partners across the states be successful. Related to mobile crisis teams, we are really excited. We're on the verge of the launch of our fire-based mobile crisis teams. Those teams have been hired and everyone is under OJT. We are hoping for them to go live in May. We know it has been a critical piece for the community to ensure that not all of our mobile crisis team responses are done from law enforcement. So this hybrid gives us an opportunity to have a first responder response as a partnership with the Bernalillo County Fire Department, but it still brings a master's level clinician to people in need. So we're excited about the launch of those teams. Now they will refer to CET so that there will be a level of follow-up with clients who get a mobile crisis team response. And that is, again, a very critical component and part of that continuum of care. Last piece, back on school-based health centers. So we have been meeting with Commissioner Piscotti, Commissioner Quesada, a couple of board members, community schools, and other partners. As I mentioned, we have a meeting with Ms. Muir in the coming weeks to really start fleshing out what that looks like. The hope is that we have some of these services available for the upcoming school year. Councilor Sena, you did mention how critical it is for us to focus on the youth and their needs as they go back to school. We expect even in the fall, those needs will be even greater. They'll go back to school for about a month, then go back on summer break, and then they'll be back in school regularly. And so we want to make sure that come the fall, we have those additional supports available to them. I think it's also important to recognize that we are essentially preparing for what we are hearing in the behavioral health world as a post-pandemic epidemic in addressing behavioral health needs as a response to the pandemic. So we are working with local and federal partners to find ways that we can leverage existing systems, be able to provide safety nets for folks who are already seeing the behavioral health effects of the pandemic, and for those who are yet to see the behavioral health of the impacts of the pandemic. Even if we speak purely about the loss that our first responders and our frontline workers have experienced, I was actually on a call earlier this week with Secretary Hotram Lopez about developing a plan for peer supports for employees from the nursing homes because they're clients. And so we are working to build those supports and be there to be that safety net in the community. So with that, I will just stand for any questions.
Are there any questions? I think you covered it, Margarita. Thank you. And so moving on, this is an opportunity for subcommittees to address the commission. Is anyone present from a subcommittee?
Madam Chair, I believe we only had Michael and he addressed it on the community connections item.
Okay, great, perfect. So then,
Madam Chair?
yes, Commissioner Barboa.
Sorry, thanks. Thank you, Madam Chair, and members of this council. That subcommittee, is that regularly an opportunity for subcommittees to present? And I've just been in, when do we get to hear from subcommittees?
Madam Chair, that agenda item is a standing item. And so the committee members know that if they'd like to address the ABCGC, we have that item standing at any time. And so they just kind of let us know. We patch them in with Julie and she was able to bring them into the meeting.
Awesome, thank you.
Thanks. Is there any other business that needs to be discussed this evening? Seeing none. The next
Madam
Bernalillo.
Chair?
Oh,
Sorry,
yes.
real quick. We have board member Elizabeth Armijo with her hand up.
I'm sorry, go ahead, Elizabeth. I didn't see your hand.
Sorry, and I got a little bit behind. I have a question for Margarita. I just wanted to make sure you were still with us. I see you now. Thank you. I was just curious in reference to the school-based health centers, is there going to be both primary and behavioral health care?
Madam Chair, Board Member Armijo, this funding is really focusing on behavioral health supports, but it is not exclusive to that. So there is room for us to kind of discuss what the needs in the community are. The difficulty of it is what we know is that there is limited funding for behavioral health supports as far as reimbursement is concerned. And so we want to ensure that these behavioral health gross receipts tax dollars are dedicated to providing funding for services that are not otherwise funded. Nonetheless, if we are looking at a renovation that is bricks and mortar for a school-based health center, we're not just going to renovate the room that's going to provide behavioral health supports, right? It could be for the entire school-based health center, but the sustainable funding will really want to focus on the behavioral health supports.
Thank you.
Okay.
Board Member Patterson, Madam Chair.
Yes, go ahead, Board Member Patterson.
This question is for Margarita. Margarita, thank you so much for your presentation, all the wonderful information you have provided this evening. One of the questions I have, it was my understanding from meeting with Robert Beatty from RFK that there is funding that has been provided for a mobile clinic. Can you talk a little bit about that or where we're at with that?
Madam Chair, Board Member Patterson, we do have an appropriation through that project for capital and appropriation for recurring dollars. So we are looking at the possibility of purchasing mobile units and or a hybrid of brick and mortar supports. And so right now we are vetting all of the options. As I mentioned, we have a meeting with Ms. Muir, and I believe it is next week, to really talk about those needs. We know that those mobile units will help us to stretch that. And so I think what we're looking at is potentially a hybrid of the utilization of the dollars between mobile and some existing space renovation and or modification.
Madam Chair, I have a follow-up question, if I may?
Yes, go ahead.
Okay. Margarita, so how many are you proposing? How many mobile clinics? I think it's a wonderful idea, but will you be dividing this among maybe mobile clinic for students where we don't have any, which is in the West Mesa area, around that area where we have Jimmy Carter and Truman and those schools in that area, and John Adams. We don't have a clinic that really services that area. So I'm thinking, are you looking to service the schools and then maybe a separate one for adults as well? Are you looking at that?
Madam Chair, Board Member Patterson, we are looking at all options right now. We're looking at the data and what information we have on what schools are not served, what schools have the highest demand and highest need. It has been a priority to ensure that these services also provide supports for families. We know that the youth cannot be successful unless the family also has that additional support. And one piece that's really a little bit different is providing supports in elementary school settings, right? Not a lot of school-based health centers in those elementary school settings. And so we know that a lot of times families are also shift workers. So if there's a clinic that's only open 8 to 5 and they get out of, and they work 8 to 5, they can't access that. So how do we ensure that these mobile units have kind of those modified hours into the afternoon or maybe a weekend day? So we're looking at all of those options. On the last conversation, we were exploring the possibility of a mobile unit having an opportunity to move into different districts based on the day of the week. So Monday I'm at Jimmy Carter, Wednesday I'm at El Dorado, being able to move to spread that support across the community. And so a lot of that is being vetted right now. I can't give you a solid where those will be identified and how many. We do have a one-time allocation of $800,000 for those supports. And so once we really come up with a plan, we'll need to request some quotes and really see what that looks like so we can stretch that dollar as far as possible.
Wonderful. Thank you so much for all the work you do. It is amazing. Thank you.
Yes, thank you. Commissioner Barboa.
Thank you, Madam Chair. Just one more quick question while we have all the experts on the call. I know many years ago, at least, school-based health centers would provide, like my son went to Wilson Middle School, my daughter got sick, and I was able to take her as part of the family member of the school district to get checked, and it was quick in and out and not a long wait, and that was really helpful to have those sort of non-urgent or emergency needs served. Is that still true? And is that what we're for school-based health center? Do they serve the whole sort of school, the whole family, as Margarita was talking about? And how much do folks know about that? Or is there, wide knowledge that you can actually go to the school-based health center if you just have a little something that needs help?
I'll take that one. Thanks. Thank you for that question. We actually had a very positive thing happen because of COVID. And all of our school-based health centers, except for, a year ago in March in the spring, a lot of them had to close down because their staff are being pulled from their facilities to, like UNM, were pulled to UNMH. But when we started up in the fall, all of our school-based health centers reopened, and we opened them to all students. So, and it's by level. So if you're a high school student, any high school student in APS or charter school could go to any one of our high school school-based health centers. Same thing for middle school and elementary. And so any student can go, and now that we're going back to full reentry, we're keeping that, and we're going to see how it works. So that students can attend a school-based health center even if it's not in their school. It'll be a little more difficult, especially for the centers that are like in the middle of a school, but we're working on that. It would be by appointment only, those types of things. So what you were talking about in terms of the feeder pattern had always existed, but now we've opened it up even farther. And we're hopeful that potentially with this new partnership with the county and what they're thinking about, like Margarita said, we have a meeting and we have lots of questions, and I'm sure she has lots of questions, and we're going to kind of hash through what we might be able to do with potential mobile centers, those types of things, and serving the community. So the one issue that we will have is we do not serve adults in our school. There's for students. And so we don't serve adults in our school-based health centers except for one, and that's the Atrisco Heritage, which is a community center, and it has it has its own issues. And so we'll be working through that, but with a mobile unit, and extended hours, there may be other possibilities to serve adults and families. It's having adults on our campuses when school's going on is really the big issue with school-based health centers, and making sure that kids have access to a center with confidential services without other adults present. So if my child goes, then, you know, Margarita isn't there and knows me and says, oh, I saw your kid at the school-based health center. What are they doing there? You know, kind of thing. So there, but all those issues we've been working through, and now this is a new opportunity that we're very interested in pursuing with the county to expand services for kids and potentially their families and how that might work. So yes, that was a long answer to a very short question, but yes, our school-based health centers are open to all of our students now.
Thank you, Dr. Mayor, Madam Chair.
They know our kids did a video and they blasted it out on all of their social media. The students did a video to let all of their peers know about school-based health centers. I think you can find it on the APS website. It's a great video and it talks about the services at school-based health centers. We are so proud of those students. We used part of our grant funding from the Centers for Disease Control, and they're going to be doing, I think, another video real soon to, on expanding issues for teens and how they can get access to care.
Thanks. Any other questions? Okay, I'm not seeing any hands. So I will go ahead and announce the next Albuquerque Bernalillo County Government Commission and APS meeting. It will be Thursday, April 22nd, 2021. That will be Earth Day. ABCGC plus APS meeting at 5 p.m. via Zoom. And if there's no other business, this meeting is adjourned. So have a good night, everybody, and we will see you next month. Take care.